Heart health is so important to maintain, no matter your age. So today we are discussing some common heart health questions doctors hear, and some tips to keep your heart healthy. Joining us for this episode is Dr. Benjamin Tillinger, a cardiologist with Emerson Health Cardiology. This is HealthWorks Here. I'm your host, Caitlin White. Well, doctor, thank you for being with us today. To start us off, how can you tell if you might have a heart issue?
There are many symptoms that can signify a heart issue. It can range from feeling palpitations or racing heartbeats or skipping heartbeats if it's related to an arrhythmia. Certainly when patients have chest discomfort, whether that's a chest pain or a burning or tightness in the chest, which could be more consistent with angina or blocked arteries or ischemic heart disease. And then a very common one is to get short of breath, either with exertion or for some patients even at rest or when they lay down to sleep at night. All of these are common symptoms suggestive of a potential heart issue.
So if I'm suffering from any of those symptoms, what should I do first?
Certainly it depends on the severity of the symptoms. Obviously in an acute setting, if someone's having severe symptoms that are not resolving on their own, dialing 911 and getting to the emergency department is very important. Because symptoms can be somewhat atypical or different for every patient, we often ask people to be mindful and noticing when they're having these symptoms and have a fairly low threshold for calling and checking in. If symptoms are milder or only occurring with certain activities or at certain times but then resolve, it's best to start with a primary care doctor evaluation who then would often refer a patient on to see a cardiologist like myself.
So if you need a cardiologist, how can you find one that will be a good fit?
Well, first and foremost, it's getting a referral from a primary care doctor is often the best step. Primary care doctors know the cardiologist in the area and are generally able to make some good recommendations and referrals. And then secondly, it is always important to find a good fit with all of your healthcare providers. There are different personalities and different chemistries and different styles of practice. As in our style of practice, we tend to have all of our patients seen by the cardiologist, at least for the initial visit. We also work closely with our nurse practitioner team so that patients have access to a provider more frequently. And it's important that the chemistry is there so that there's comfort and easy rapport. My goal when I see patients is to make sure they understand what the problem is, what the symptoms might be, and how we're going to address it. I always like to make sure patients know the different options as far as managing it, whether that's simple things like diet and exercise, whether that's medications, whether that's procedures, and kind of understanding all of the risks and rewards and pros and cons of those approaches.
So then you make that first visit. What should you expect at your first appointment with a cardiologist? At
almost all cardiology appointments, you're going to have some basic evaluations such as vital signs, blood pressure, heart rate. Most cardiologists will do an EKG on the first visit as well. Then depending on the symptoms that someone is having, often will require further evaluation. That could include something as a heart monitor, a stress test, an echocardiogram, or other ways that we evaluate the heart. Because cardiology and heart health is so important, we often take most of these symptoms and complaints very seriously until we've evaluated all the potential possibilities. It's important when patients come in for their initial evaluations that they're very transparent with their symptoms. There's certainly no advantage with hiding or minimizing symptoms. It's important that the doctors are able to get to the root of the cause and see what we can do to address it.
That's always a great reminder to just say everything that's on your mind. In general, doctor, what are some of the best ways that we can keep our hearts healthy?
You know, that's a great question, and it's very important to me. I discuss with my patients overall heart health on almost every single visit. The basics are things that most people know but are not always easy to implement. So eating a healthy diet, exercising, and getting adequate rest are probably the cornerstones of a healthy lifestyle in general. When it comes to cardiovascular health, exercise is probably the most important thing that patients need to make sure they're maintaining throughout their life. Our recommendation is to get 150 minutes of cardio exercise every week. Cardio exercise is generally sustained activity where your heart rate is elevated. I don't necessarily recommend that patients have to monitor their heart rate when they're exercising, but exercising to the point where they know they're getting some exercise, where they're breathing a little bit heavy, but they're able to do 20 or 30 minutes without stopping. And ideally, you want to get to about 150 minutes per week.
And wrapping up here, doctor, I know there's a lot of food that is bad for your heart, but what are some of the best foods to eat for heart health?
This is always an evolving topic, and we always try and stay most current with the research that continues to evolve. The basic principles are eating a diet that is low in saturated fats, as well as a diet that is relatively low in carbohydrates, focusing on healthy proteins such as fish, chicken, or vegetable proteins, trying to minimize the amount of dairy and red meat products, as these definitely will impact cholesterol and heart health. Focusing on healthy fruits and vegetables as a part of your diet is also very important. And I also recommend, certain healthy foods that are always going to be beneficial, things like avocados, walnuts, things that have healthy oils and fats and minimal amounts of carbohydrates and what I would call bad fats.
Well, just some great tips and information here today. Dr. Tillinger, thank you for being with us and sharing. To learn more, you can call 978-287-8767 or visit emersonhealth.org. And thank you for listening to the Health Works Here podcast. Subscribe to this podcast on your favorite podcast source, including Apple Podcasts, Google Podcasts, and Spotify. I'm your host, Caitlin White. We'll see you next time.